It's 10 years since United Nations set aside October 15 as Global Hand-Washing Day to raise awareness on hand washing with soap to prevent diseases. But since then, the campaign has not made much impact, with statistics in the sector still alarming. A UNICEF report says children across the globe miss 272 million school days each year due to diarrhea infection. And Water Resources Minister Suleiman Adamu says Nigeria is having a fair share in this.
Over 59,000 children under the age of 5 die annually in Nigeria from diarrheal diseases attributed to poor water and sanitation. And about 33% of children under 5 years are stunted. The absence of wash facilities, including hand washing stations in schools, healthcare facilities and workplaces, is an equity issue for girls and women, particularly for menstrual hygiene management. The availability of hand washing stations can stop the spread of diseases in these settings. It must be noted, however, that the benefits accruable through provision of these facilities depends on the utilization. Behavior change is required for people to wash their hands consistently at key times. Hand washing is a choice that we need to make multiple times a day. When we choose hand washing, we are choosing to create a healthier environment, not only for ourselves, but also for those around us.
To intensify this campaign, the ministry is set to sensitize policymakers on the cost-effectiveness of hand washing with soap and involve private sector to sustain the promotion.
All these activities are aimed at engaging children as agents of change and creating massive awareness across the country on the adoption of the habit of washing hands at critical times. As I conclude, the tagline, "Clean hands, a recipe for health," reminds us to make hand washing a part of every meal. I therefore enjoin us all to always remember to use this key recipe for health and be an advocate for making it a habit as we celebrate the 2018 Global Hand Washing Day. We should choose hand washing not only on Global Hand Washing Day, but every day.
Development partners in the sector say they are now targeting abattoirs, marketplaces and schools to boost the awareness on hand washing and general hygiene practices.
Most of the meat that we eat in this country comes from abattoir. And if you go to the abattoir areas, you see that it's an eyesore. The hygiene aspect of it, the sanitation aspect of it is really not there. And yet, a lot of people fall sick and we attribute it to so many other things. So for us and as an organization, we feel that yes, hand washing is very critical, but if we are talking about the issues of sanitation and we are looking at the implication it has on health, we really need to begin to target the critical areas, the critical places that we feel that should be taken on board. And that is why WSCC is going to abattoir at this point in time.
Nigeria wants to become open defecation free nationwide in 2025. So we are in the forefront of wash activities.
With various policies and programs set in motion by the federal government to address sanitation challenges, participants here say state governments need to follow suit with more purposeful commitments in this regard. In Abuja, Musbal and Wahab, NT News.